Amazing, isn't it? The human brain. What a tremendous computer that controls every one of man's movements, sending its signals for various activities through a complex system of nerves. Yes, nerves. That's what we're going to talk about today. The nervous system, neurology, neurosurgery. How important is the nervous system? Well, don't you refer to it every day? We talk of being nervous, nerves on end. You talk of someone being unnerved. You talk of someone having nerves of steel. You also talk about something being the nerve center of things. Now that's how important the nervous system is. And we're going to talk to one of the pioneers in India. In fact, one of the most celebrated neurosurgeons of the world, Dr. B. Ramamurthi, who has been elected the honorary president of the World Federation of Neurosurgeons. And he's going to tell us all about the history of neurology and neurosurgery globally, in the Indian context, and talk also about the future, the nervous system, neurology, neurosurgery. So hang on while we talk to Dr. B. Ramamurthi. India is an ancient country, and her civilization is nearly 6,000 years old. Her remarkable heritage embraces an incredible spectrum of human endeavor, ranging from art, music, culture, and philosophy, to astronomy, mathematics, and medical science. Though her achievements in fields like art and philosophy have been recognized to some extent, her contribution to the field of medical science in ancient times has not received the notice it deserves. Shushruta, a great surgeon, articulated nearly 2,000 years ago the basic postulates of surgery, and his Samhita refers to a variety of procedures relating to different types of inflammation, fractures, abdominal operations, and even plastic surgery. History has recorded an operation performed by Jivaka on King Bhoja using the anesthetic drug Sanmohini. Before the Second World War, India could boast of a good standard in general surgery, but neurosurgery was performed only sporadically in a few centers in Bombay, Madras, and Calcutta. Neurosurgery was in the same state as in most of the developing countries of the world in 1949. The lamp was lit in South India in 1949 and 1950 in Vellore, and Madras. In 40 years, India was able to host the World Congress attended by more than 500 neurosurgeons from over 80 centers of neurosurgery in the world. It's a great privilege to be talking to you, Doctor. Let's start by asking you, how do you look back over these 40 years of neurosurgery in India?
In the development of medical sciences in India, the past 4 decades have indeed been very exciting. Many medical specialities have developed to a very great extent in our country, and one of the early specialities to start was the surgery of the nervous system and the brain. Starting with almost no facilities at all and no help, we have now progressed so much that we were able to invite the World Congress of Neurosurgery to New Delhi in 1989. So I think this indeed has been an era of tremendous achievement.
Would you like to tell us how you entered the medical profession and went on to neurosurgery, and maybe you would like to start by telling us something about your schooling and the influences in those days on you?
I would say I have been lucky being born in a good family. My grandfather's father's brother was G. Subramanya Iyer, the founder of the Hindu and the Swadeshamitran, a great social reformer and who fought for independence of the country. And on my mother's side, my grandfather was a very intelligent person, very much interested in mathematics and very proficient in Sanskrit. And my school was the ER High School in Trichinopoli. As you all know, it is one of the best schools in South India. And later, I joined the St. Joseph's College. Mr. Nataraj was the headmaster of ER High School, and Jerome de Souza was the principal of the St. Joseph's College. So you can imagine what sort of an academic stimulation we had as children and as college students.
Quite so. But Dr. Classics and mathematics to medicine, that seems rather far cry.
Yes, actually, I wanted to either specialize in mathematics and go to mathematical astronomy, or go for the ICS. In those days, ICS was a very attractive proposition. But my father and also Dr. T.S.S. Rajan, one of the well-known Congressites in South India, they told me that ICS or no ICS, you will still serve somebody. But if you are a doctor, then you will serve the public.
Gotcha.
And you will be independent. So, after all, I was 15 years old, and the decision of the elders was, certainly a very acceptable one. And so I entered the medical college.
That's interesting. Well, Doctor, how was medical education in those days, and what was, for instance, the effect of the Second World War?
In 1938, when I entered the medical college, there were only about 20 medical colleges in the whole country. And the Madras Medical College was easily the best medical college. And having got the first mark in the intermediate, I had no problem in getting into the medical college. Of course, medical students in those days had an enormous superiority complex. We all used to dress in complete European clothes, which was compulsory. And it was a 5.5 year course, so we stayed long in the college. And in addition, there were a number of girls in the college, which is rather unusual. So all this combined to make us feel that we are God's children on earth and walk our head high up.
Just a word here, Doctor, just a small question. Would you say it was more difficult to get into a medical college then than it is now?
I would think so, because the number of seats available were very much less. And the competition also was much keener in those days. So I think this was a bit more difficult. As far as World War II you asked, it came on in 1939, but it did not affect us very much in the early years. There was no inflation, prices were very cheap, even in 1943. I remember finishing the medical college, life was quite easy. The only way we got affected was that some of my classmates joined the army. I didn't want to join. And in 1942, you may remember, the Quit India movement came in. And we took, I myself personally took a large part in it and got arrested.
I see. Where was
for
this
a few days. This is in Madras. And the chief secretary at that time was my namesake, Dr. Mr. S.V. Ramamurthi. And he said, what's the idea of arresting medical students? Because they are necessary for war effort.
Yes.
So release them immediately. The other thing I would like to mention is that I joined the University Training Corps.
Yes.
That induced a lot of discipline in us. Life was made tough. The British trained us very well, and
the UTC as it was.
The UTC as
right.
I think even now that was a very good training for us. The present day NCC seems to be a very sort of a lax organization compared to the UTC of those days. So my memories of medical college are very pleasant, and we had such excellent teachers.
Did you, after your medical degree, did you specialize in any branch of medicine?
Yes, I went into general surgery, and in those days, there was no other specialty. So I did the Master of Surgery in general surgery in 1947, and was hoping to put up probably a nursing home and do some general surgery. We are now standing at the hallowed site of the Madras Medical College, one of the oldest medical institutions in this country. Behind us, you can see the building which was built in 1835, and you can see the old Roman columns that have been used. Today, this institution is the largest undergraduate and postgraduate medical center in the whole of India, and it is a matter of great pride for me that my father, Dr. Balasubramaniam, was a student in this college in 1913-14. I studied here, and later on my son also was a student of this college. More than that, my wife, Dr. Mrs. Ramamurthi, was a classmate of mine in this same medical college. And also her father, Dr. Lashmipati, was a student in this college in 1908. I entered this institution as a raw student, graduated from here as the best outgoing student, did my post-graduation, then started neurosurgery in this place, and later on became a professor. It is a unique opportunity for me that I have worked all the 40 years in this same institution, entering it in 1938 and leaving it as a principal of this college in 1978. This is the office of the principal of the Madras Medical College, which has been adorned by famous teachers like Dr. Lakshman Mudaliar and Dr. R.V. Rajam. Of course, I was very proud when I occupied this chair. The date on which I took charge of the principalship is very interesting. It was 1st April 1976, All Fools' Day. So I was wondering what I was letting myself in for when I took over charge on April Fool's Day.
Coming back to what we were discussing earlier, Doctor, you had talked of general surgery. You have made the shift, or you had made the shift from general surgery to neurosurgery. What made you make the shift? How did you think of it?
I was working with Dr. Narasimhaiah, one of the great surgeons of that time, and in his department we were doing some cases of surgery of the nervous system. So there was some little interest. And in 1946, just before independence, the government of India announced some scholarships for training abroad. Mm-hmm. And one of the subjects was brain surgery. I was keen on taking up what's called thoracic surgery.
Yes.
But my chief said, no, neurosurgery is a new field, it's a challenging field, and I think you should apply for the same. And hence I did it. And when I went to Simla for the interview, the wise men there told me that I was too young. Mm-hmm. So I told them it is only young people who can learn new tricks. Yes. But they didn't cut any eyes with them, and they selected Dr. Juma, who later on went to Pakistan, and Dr. Ginde from Bombay, who were about 12 years older than me. Mm-hmm. Then I came back to Madras, and then the Madras government decided that they wanted to train people in specialities, and then sent me to the United Kingdom for training. Here, I'd like to mention that many of my professors discouraged me, saying that there is no brain tumor in India, you are wasting your time and talent. But it was my father and my wife, Mrs. Indira Ramamurthi, we were just married then, and my mother-in-law. These three people, they insisted that I should take up this new challenge and go ahead. So I should express my gratitude to these people.
Yes, indeed. Would you say that the United Kingdom was the major center for neurosurgery in those days? Would you also like to comment on the global status of neurosurgery prevailing then?
See, we had very close liaison with the British medical education system, and most of us aspired to go to the United Kingdom to learn surgery. And at that time, neurosurgery in the United Kingdom was quite advanced. We had Professor Jefferson, Professor Dott, Mr. Rowbotham, with whom I worked, all great names in neurosurgery of those days. Of course, there was also in Canada, Professor Penfield. Remember the Dr. Jacob Chandy,
yes,
from Vellore, who is a pioneer in India. He went to Canada, and Dr. Ram Ginde also went to Canada, where they spent 4 or 5 years. But I thought it is better I spent time with the United Kingdom, and I think that was a good choice. Mm-hmm. In those days, of course, as you asked globally, what was the status? Diagnosis was very difficult. And once we made a diagnosis, surgery itself, the technique of surgery also was very difficult. So our results, were not as good as these days. So it was a very challenging type of training I had to undergo.
Which year was this when you went to
This
UK?
was in 1948 to 1950. Mm-hmm. And after finishing my study in the UK, I spent about 9 months in Montreal with Professor Penfield, learning some technical aspects of what you call electroencephalogram and all that. Mm-hmm. Then spent some more months in the United States and the continent of Europe, and came back to India in October 1950.
Would you say the United States was a very major center for neurosurgery in those days?
Some centers were, but Canada was a more important center. Canada and Sweden, these were the Stockholm, these were the major centers, and I visited both of them to learn some new techniques.
But you visited the United States over an extended period. I think you visited a lot of clinics
yes.
in the United States.
I went to actually the Mayo Clinic, where I saw the great surgeons, especially Professor Adson. And he had a very short temper. Mm-hmm. So he used to throw out the assistant if he doesn't assist properly. So he threw out the first one, then after a few minutes the second one was thrown out, and then the third one. And then there's nobody to assist. Mm-hmm. So he said, come on, get back the first fellow. It was very interesting to see that. But after surgery, he was a very, very jovial person. Like this, I could tell many anecdotes about many neurosurgeons of the US, mm-hmm. but that will take quite a long time.
But were you witness to many path-breaking operations done in the United States and abroad in those days?
Yes, both in Canada, where surgery for epilepsy, which I got very much interested now, was one of the major pioneering areas under Professor Penfield, and with Professor Earl Walker in Johns Hopkins in Baltimore. So these are some of the highlights. And also I must mention here that in Philadelphia, there is a special experimental surgery center where Dr. P.K. Sen mm-hmm. Got trained. I was with him at the same time. I am mentioning P.K. Sen because he was the first surgeon to do cardiac transplant in our own country.
Yes.
So I think he is worth remembering.
Definitely, yes. And what was the status of neurosurgery, say, in Europe? I'm sure you must have traveled in Europe at that time.
In Europe, as I told you, the highlight was, of course, in Stockholm. But Germany, it was just beginning. There was Professor Tonnis in Germany. And in France, there were very good people. But most of the power was centered in Stockholm with Professor Olivecrona, who was one of the really very leading figure in European neurosurgery. Russia also was very advanced in those days.
You had occasion to visit
Yes,
Russia?
I visited Professor Igorov. Mm-hmm. He is one of the very early neurosurgeons. The peculiar thing is, in those days, in Europe, all operations were done under local anesthesia.
I see.
Not general anesthesia, whereas in Europe, in the UK and the USA, people were anesthetized, so they were unconscious. But here, injections were given. Locally, it was became dead as a part, and then the operation was done. So the patient was awake. That must have been a tremendous strain for the patient.
Sorry to interject at this stage, doctor. Why was this different technique adopted?
Because the general anesthesia was not fully developed in Europe and Russia in those days. They developed it much later, almost 9-10 years later. So that was one of the interesting things that I saw.
During your stay abroad, doctor, you would have witnessed several outstanding operations being performed, outstanding surgeons. You then returned to India. That must have been quite a problem. Would you like to talk about the problems you faced?
Of course. See, 1950, when I returned to India, there was complete ignorance about brain surgery, not only among the public, but also in the profession. And the first thing I had to do was to secure a place for myself. And having been sent by the government of Madras, they were able to appoint me as an assistant surgeon and told me to develop neurosurgery. But the problem was how? Luckily, we had Professor R.V. Rajan, one of the doyens of medical profession in India, a very highly respected person. He was the dean at that time, and he was all for encouraging me. More than that, there was Colonel Sangamlal, who was the professor of surgery. And he told me, I will give you 4 of my own beds.
I see.
And you could operate in the afternoon of my operation days. I don't think any surgeon of the present day would have been so magnanimous as to give an upstart, a very young fellow, claiming to do brain surgery, some beds. But he was really good. And then started the work. You see, there was no facility, no instruments. I had brought some instruments from England, and we had to manage with whatever there was. And in this connection, I would thank Dr. Munuswamy, who was the surgical registrar in the general hospital at that time.
Yes.
He put together all sorts of odd instruments and made some new ones, and I was able to start doing brain surgery. And also I had to educate the profession, give lectures, and then convince the public that all people who are operated on the brain don't die. That was a challenging task. I mean, looking back at it, I even now feel quite apprehensive. But somehow I managed, and we succeeded.
A little while ago, doctor, you talked about the EEG. Did you have a machine with you in those days? Who helped you in these situations?
At that time, we must mention Dr. S.T. Narasimhan, who is actually the real pioneer of neurosurgery and EEG in India, because he came back in 1948 and set up a private neurosurgical center. So I think this was before Chandy, so I should say Narasimhan, Chandy, and then myself. That's how it should go. And he had brought an EEG machine, and he joined as an honorary assistant in my department. And we could use his machine for my hospital patients.
Oh, you were able to use this machine?
Yes, yes. And it took a long time, almost 6 years, before the government of Madras sanctioned the machine. And that was also due to Mr. T.M.S. Mani, who became the health secretary. And when he came to know that I had no EEG machine, he was able to sanction it within a week. So there are many, many names which I can remember who have helped me in those days.
Tell me, doctor, what was the status of other neurosurgical centers in India at that time?
The other center we started was 2 years later, and that was in Bombay when Dr. Ginde came back. Ginde was an outstanding neurosurgeon, a great clinician, and a good pathologist. But unfortunately, he couldn't train many people in his school. In 1954, Dr. Chatterjee started in Calcutta, and followed by Ashok Bakshi, and that the Calcutta School, Eastern School developed. Dr. Bala Parameshwar Rao was deputed by the Andhra government to work under me in 1955, and after finishing training with me, he was one of the early people who started work in Visakhapatnam. So these are the early pioneers. Of course, I should mention now that in Delhi, the All India Institute invited me to become the professor in 1956. But when I went to Delhi, there was very little there, not even a building.
Right.
And while I was debating on this, Professor Penfield, I have mentioned already Professor
Yes.
Penfield, he came to Madras, he came to Delhi, saw both places, and he told me, you have done a good job here. It'll take a long time, don't waste your youth and waiting for opportunities, so go ahead in Madras. Later on, the job was taken by Professor Tandon,
Yes.
P.M. Tandon, who is again an outstanding scientist and an excellent surgeon, and he is now the president of the Indian National Science Academy. A neurosurgeon being a president of the All India Science Academy is a real great achievement. So these are the early names that I remember, and of course there are many other people who developed in Samba Shivan in Trivandrum. I already told you about the Vellore school.
Dr. Chandy.
Then Dr. Gulati in Chandigarh, and Dr. Dave in Lucknow, and so on.
Doctor, when would you say things began to improve in your field? Did your results start getting better? Did some new techniques emerge?
Yes, you see, the main problem in the very early days was the increased pressure inside the head. You know, the head is a closed cavity, skull. So when any tumor or water accumulates inside, the pressure increases. And that is the cause of trouble, cause of mortality, death, and all that. And in those days, we had very few facilities to reduce this intracranial pressure. And that is why, and patients came very late, almost blind, high pressure. So we had a mortality of almost 1 out of 3 patients dying after brain operations. But after a few years, the technique of anesthesia improved, and they were able to wash out the what you call carbon dioxide from the blood.
Which was
And
causing
that was the cause of the increased pressure.
Yes.
And once they did that, the pressure began to go down and surgical results improved. I must mention here Dr. V. Rajagopalan, who was the chief anesthetist in Madras Medical College, and Dr. Kabir. These two specially got trained in this area and helped me in the very early days. One more thing I would like to mention here, it is not only brain surgery that improved, but also surgery of the spinal cord. Now, spinal cord also is a very important part of neurosurgery. So I remember a patient who had a paralysis of both legs. He was a great artist, a painter, and luckily he had a tumor which I could remove.
In the spinal column?
In the spinal column, in the back, in the spine. And within a few months, I was able to walk and run about. So in gratitude, he gave me a beautiful painting of Nataraja, appropriately,
the Lord of
the
Dance.
Cosmic Dancer.
Yes.
Yes.
Tell us, Doctor, something about the training facilities available in those days. Was the university offering any courses? Tell us something about the trainees who came out of these courses.
Yes, once we established the basic facilities for neurosurgery, we had people come for training, but it was not a formal training. I told you Dr. Bala Parameshwar Rao came for training. But by 1960, 10 years, here I must again thank Jacob Chandy, and both of us could persuade Madras University to start a training course in neurosurgery and call it MS, Master of Surgery.
How many years was
in
this?
neurosurgery. That is a 3-year course. And in those days, it has to be done after they finish their MS in general surgery. They finish general surgery and then they come to us and did 3 years. And one of the early trainees is Dr. Bala Subramaniam,
Yes.
who is a very good neurosurgeon.
Yes.
then Dr. Natarajan, who retired as Professor of Neurosurgery from Madurai, and later on Kalyan Raman,
Yes.
and Dr. Narendran. All these were the early
Products of
this system of special training. The examination itself was very tough, and there were 4 examiners, and the candidate had to conduct an operation in presence of the examiners.
As part of the
Examination.
course.
They were part of the course of the examination, and that would have been quite tough. But they went through it, and we had good results.
Sorry to interrupt, but this examination was on actual patients?
Yes. They had to operate on a live patient. Of course, the chief of the unit will assist, but he had to operate and show his skill.
Isn't that rather unusual?
It is, but we had to train them to such a degree. It is not a theoretical training. He must be a competent surgeon, neurosurgeon, when he goes out, because he goes to a place where there are no facilities.
But does this practice still continue, doctor?
Till about 6 years ago it did. In some universities we still have it.
So in 11 years, this specialty had grown enough to start a program for it. What about other centers? What were they doing at this time?
Madras and Vellore started together for MCH, and later on the Bombay University started, and then the All India Institute of Medical Sciences.
Yes, we have talked about that.
Yeah, these are the areas where which developed fully.
Within the field of neurosurgery, doctor, were you particularly interested in any special area, special field, special technique?
Quite so. You see, about 1961, all over the world, there was interest in microneurosurgery, using the microscope. So I got trained in microsurgery in Vermont. I went specially for that. Then came back, but somehow I didn't develop that specialty then. Then I would have been a real pioneer. That came into being almost 15 years later. Mm-hmm. I didn't anticipate it. But the area I really developed was what is known as stereotactic surgery, a very intricate type of
Could you explain
brain
that?
surgery. Sometimes it becomes necessary to make a small operation in the brain. For that, you cannot cut open a large part of the skull and cut normal brain. So, the technique of stereotactic surgery has been invented. Stereo means 3-dimensional. For instance, you can see this instrument here with markings. Number of markings are here. This is put on the patient's head, on the skull, and fixed. After that is done, X-rays are taken with this X-ray arm. Once these X-rays are available, we make very intricate calculations using this sort of a chart. It is like pinpointing the moon in a moon voyage. Once we know the 3 dimensions, X, Y, and Z axis, we fix the carrying frame. This is the carrying frame. And you see, this is a small electrode or a needle. Only this goes into the brain. We make a hole, small hole in the skull, then attach this semicircular frame to this frame, and then introduce the needle. Now if you look at the tip of the needle, whichever way I enter, it is still in the center. It won't change. Same way, you see, I may tilt it this way, that way, because this radius is the same as that of the sphere. So wherever we enter the brain, whichever part, we make a hole in the skull, the tip of the needle will go exactly in the right spot. This is called stereotactic surgery. Then we fix it like this and introduce the needle. The needle will always reach the right spot. After that, we do some stimulation. We pass a small current, make sure it is in the right spot. And once we know we are in the right spot, then we heat the tip of the electrode. This becomes very hot. and that part of the brain, small portion, about 0.5 millimeter of the brain is destroyed. Once that is done, the disease will stop. Would you believe that a governor and a prime minister were involved in this development?
That sounds interesting. We'd like to hear about this.
Yeah, it is the governor of Sri Nagesh. He was governor of Andhra Pradesh.
Yes.
You know, his brother was Lieutenant General Sri Nagesh.
Mm-hmm.
And he had this disease called Parkinsonism, you know, the shaking tremor, where the
Parkinson's
shaking
disease,
palsy,
yes. Yes.
the hand goes on shaking like this.
Yes.
And he was operated in London. And he had to get operated the other side because he had developed it on the opposite side of the body.
I see. Uh-huh.
So he called me for consultation. I went to Hyderabad and he said, how about doing this operation? I said, we can do it, but we don't have all the facilities.
Uh-huh.
So I suggested after dinner, a sumptuous dinner, that why not invite the whole team to India? Then they can operate on him, and also we can learn the technique, and hundreds of others will be benefited.
Which team was this, Doctor?
This is a team from London, from the St. George's Hospital.
They specialized in Parkinson's?
They specialized in Parkinsonism. Of course, they are specialists in whole neurosurgery, but this one. So immediately General Sri Nagesh telephoned that night itself. Jawaharlal Nehru, he must have been a good friend of Jawaharlal Nehru.
Yes.
And Nehru agreed. And within 1 week, arrangements were made for the team. It was Mr. Lawrence Walsh, neurosurgeon, and Dennis Williams, one of the leading neurologists of Great Britain, and a nurse and a team with all the instruments. And
Well, the equipment had to come from there, or
they have brought the equipment
with them?
With them. Then they left it here.
I see.
And that is how, from 1962, we have developed this unique branch of surgery, and we have done more than 1,700 operations.
I see.
Especially Dr. Balasubramaniam, Dr. Kanaka, Dr. Kalyan Raman, they all got trained in this and have contributed enormously to this field.
That was a very interesting procedure, Doctor. Do you continue to do a lot of such operations now?
Not as many as some years ago. Now the indications are slightly different. But nowadays we use a different technique using what's known as the CT scan, the latest advance, and also the MRI, magnetic resonance imaging. And these are used now in stereotactic surgery.
Doctor, what would you say is the response of the medical profession to the advances in neurosurgery in India today?
Now it is of course excellent, but in the early days I had to visit almost every district in India and give talks on neurosurgery to the medical profession. And here I must pay a tribute to the Indian Medical Association, who arranged all these lectures. And through them I was able to reach the far corners of India. In those days when anybody used to call me to operate on a patient, I used to take all my instruments, but insist that they must arrange a medical meeting. So at the end of the operation is over, I used to address the local doctors and tell them about brain surgery. That's how it spread. So much so today in South India, the cases are diagnosed very, very early. That is indeed a tribute to the medical profession in South India.
So they're able to realize that it's a neurological problem or a neurosurgical problem.
Yeah, and diagnose and suspect it early and send it. So in those days I used my patients, 90% of them were blind. But now I don't see a blind patient at all. They all come very early.
Would you like to say something about the Neurological Society of India, about when it was started and your contribution to it?
As early as 1951, there were only 4 of us. Myself, Dr. Chandy, Dr. S.T. Narasimhan, and Dr. Baldev Singh. I must talk about Baldev Singh because he is a very senior neurologist of the country. Only the 4 of us were there, and then we formed this association. And we had associate members, and the Neurological Society, we insisted that only people who do neurosciences full-time, not for instance doing general surgery and partly neurosurgery, not like that.
Yes.
Only those people should be members. So this created a lot of jealousy and problem in the early days, but that policy has been good. And now, as you know, it has grown into a very big organization. And as I mentioned earlier, we are strong enough now to invite the World Congress in 1989, both neurosurgery and neurology. And both were extremely successful conferences, both academically and socially.
And you were the president of the Congress?
That's right, of the Congress of Neurosurgery. That was indeed an acme of my happiness.
Yes, that must have been a major achievement.
Yes, because we had 2,000 friends from all over the world coming to New Delhi and greeting us. And I think both Mrs. Ramamurthi and myself really enjoyed it.
Yes, I can see that you still enjoy the memory of it.
I mentioned Mrs. Ramamurthi because throughout this saga, she has been a strong pillar of encouragement and sacrifice.
How about neurology? Did that field also interest you?
Yes, in the early days there was no separate neurologist, so I was also the neurologist. I used to take lectures in neurology, and many of the senior neurologists of today were my students. And later on, when they grew up, of course, I didn't specialize so much in neurology, and neurology itself advanced.
The Institute of Neurology, Doctor, is testimony to your personal efforts. Would you like to say something about its establishment and its growth?
I was dreaming of a separate institute from as early as 1960-65. Here I must mention Dr. Lakshmipati, who was the founder of the Arogya Ashramam Samiti, and he was able to provide lakh of rupees, 100,000 rupees in those days, 1964.
Big money.
Was a large amount of money, and gave it as a donation to the government of Tamil Nadu. Here I think I must digress, because in the early days I must also mention Mrs. Rukmini Lakshmipati.
Yes.
I already mentioned that she encouraged, but she was also the health minister, and later on a very fairly powerful person in the political circles. And her support was very useful for me to begin. And now steps in the father-in-law, and he gave this money, and we gave it to the government of Tamil Nadu, but they did nothing at all. And later on, when the government changed and Annadurai became the chief minister, I approached him because I had operated on Annadurai.
I see.
As early as 1954 for a tumor in the spine. And he had remembered it with gratitude. And at that time he wanted to know what was my fees. I said, I'm not going to charge you, Anna. You're a political figure, a social worker. So after all, I might have got about 100 rupees or 200 in those days.
Yes.
I said, no, certainly not. And for those 200 rupees, I got a huge institute of neurology.
Yes.
So he immediately ordered that institute should be built, and he wanted some more money. We gave about another 80,000, and that's how the Institute of Neurology came into being. And I must thank Mr. Annadurai for that.
Yes, it's been 25 years.
That's right.
It?
Yes. And the institute was declared open by V.V. Giri, and that was a grand function that we had. We had invited many people from all over the world and held a mini World Congress. About 200 friends had come for that function. Very enjoyable.
You retired from this institute pretty early, Doctor, in your mid-50s, I think. Isn't that surprising?
Yeah, in those days, people used to retire at 55, and I got an extension for a year. And after that, it was a good thing, because I was able to concentrate then on, you can call it a second phase of my life, in the voluntary health services, where, as you know, we have built the Dr. A. Lakshmipati Neurosurgical Center with a grant of 8 lakhs from his charities, and now it has grown into one of the premier neurosurgical institutes in India.
In these 40 years, Doctor, neurosurgery has made tremendous advances. In retrospect, would you like to talk about some of these advances?
The results that we have achieved, these have come about because of improvements in two fields. One is the diagnostic techniques.
Yes.
The diagnosis is much more precise now. And especially with the modern techniques, with CT scan and MRI, magnetic resonance imaging, the location of a lesion in the brain is very precise.
I see.
Within a millimeter, we can locate where the lesion is. And during surgery, as I told you already, the anesthesia has become so perfect that the brain pressure does not increase at all. And the other technique is using the microscope.
Yes.
So we use a microscope and are able to preserve even very small blood vessels. So the patient wakes up after the operation, completely conscious and talking, which was not possible at all, say 20, 30 years ago.
Yes.
So because of precise localization and excellent technique of surgery and anesthesia, today the risk of brain surgery is less than 1%.
That's phenomenal.
From 30%, 33%, it has now come down to 0.5%. And this is indeed a tremendous, I'm talking of Indian figures.
Yes.
I'm talking of Indian neurosurgery.
Yes.
It's a wonderful progress.
And I'm sure Indian neurosurgeons compare with the best in the world.
Oh, I would think so.
And what has been the development of neurosciences in India, Doctor?
Yes, because concomitant with the development of neurosurgery, neurosciences have advanced in India in the field of neuropharmacology, neuropathology, neuropsychology, for instance. In addition, we have also got others interested in neurosciences, like the mathematicians. Now we have got computer scientists interested in the working of the brain, understanding the brain, and what we call neural networks. Now, for instance, does the computer simulate the brain?
Yes.
Or computer scientists learn from the brain? These are all exciting areas of neurosciences. And I am the president of the Neurosciences Society of India. And therefore, we are from the Department of Science and Technology, Indian Council of Medical Research, Department of Biotechnology. We have a large number of schemes in all these areas. So, in addition to neurosurgery as such and neurology, clinical as such, basic neurosciences also are very advanced in India. Neurogenetics,
Yes.
neuroepidemiology, all these have come up very well.
I see. And do they directly contribute, Doctor, to the advancement of neurosurgery?
Oh,
Findings
yes.
of
Yes. They are, in fact, they are the forerunners of advances in the clinical field. When basic knowledge improves, it is immediately applied to the clinical sciences.
In your remarkable career, Doctor, you have received many honors, many distinctions. I know for a fact that you're an honorary brigadier and a consultant to the armed forces. How do you look back on these honors conferred on you?
Yes, in fact, I was very happy when I got this honor of honorary brigadier because, I told you about the UTC in the medical college, and because I participated in the 42 movement, I got discharged dishonorably from the UTC. And then I missed the chance of joining the army because, we are patriotic and we thought we shouldn't do that. So when, after some years of helping the armed forces with brain surgery problems, I heard the news from the Commander-in-Chief that I was being made an honorary brigadier. I was indeed extremely happy. So I telephoned my wife and told her, hey, you've become a Major General now. Because, wives are always one rank higher than yourself.
I'm sure she'll enjoy hearing this.
Oh, yes. And of course, there have been many other honors which are very nice to have. And the most important thing, of course, is to have become the honorary president of the World Federation of Neurosurgical Societies, which is something to be wished for. I never thought when I started brain surgery that this would happen, but I think that's really very, very satisfying. Of course, in India itself, I've been the president of the Academy of Medical Sciences.
Yes.
And president of the Association of Surgeons of India. And now I'm interested in the National Board of Examinations. I'm the president now, conducting postgraduate examinations all over the country. So medical education also has been an interesting feature. And I also received the Dhanvantari Award,
Yes.
which again is given to overall excellence. So these are all nice things to think about.
The world has borrowed yoga and its benefits from India. How do you see yoga contributing to the science of neurosurgery in India?
See, India's contribution to neurology, neurological sciences is yoga. Our people by intuition understood the working of the brain, not by experiment, but by intuition, working of the whole brain and mind, and evolved many techniques of improving the mind, controlling the mind, using it for useful purposes, and through mind control the body for health, good health. That is why yoga is very important. But what we have done, Indian neurologists, is to find out how yogic practices change brain function. Experimentally this has been done. We know yogic practices change body function.
Yes.
It lowers blood pressure, improves respiration, improves digestion, metabolism. All this has been proved years ago in India. Recently we have shown that by yoga the brain function becomes more harmonized, becomes more equilibrium on both sides of the brain. Thus a calmness descends on all the organs, so they work more efficiently. So yoga does not necessarily mean reaching to God or Paramatma and high philosophical level. In an ordinary day-to-day life, yoga, integrated yoga, will give you excellent physical health and mental poise and mental efficiency. After all, yoga is defined as yogaha karmasu kaushalam.
Yes.
Efficiency in action is yoga. Similarly, samatvam yoga uchyate. That is, yoga is equanimity of the mind. So when there is equanimity, there is efficiency. So our contribution, Indian contribution to yoga, and I have done a number of experimental studies on this subject and published them also with my colleagues. And Indians must be proud of it, not only being proud of it, but they must adopt it in their daily life.
Would you say, one last question on the broad spectrum aspect, would you say that neurosurgery in India is state of the art and that any neurosurgical procedure can be performed in India?
Yes, of course. That should be the message of this whole piece of work. Today in India, there are many centers, I would say at least 50 centers, where every type of neurosurgery is being done successfully. The diagnostic technique is available, the operative skill is there, and the post-operative care. So I can proudly say, looking back from 1950 to 1991, that we have come all the way to excellence in many, many centers. So there's no need for anybody to go abroad for any neurosurgical procedure at all. I can very proudly claim that Indian neurosurgeons are fully capable of dealing with all neurosurgical problems.
That's wonderful to hear, and it's very consoling to all of us who come to you with various complaints. Thank you. It's been a great privilege talking to you, Doctor, and I wish you all the best, and I wish the next generation all the best learning from you.
Thank you very much.